I'm Christine Maitre, and I work at Sheffield Hallam University in the Biomolecular Sciences Research Centre. I head up the Tissue Engineering and Biomechanics Research Group at the Research Centre, and I'm really interested in trying to develop new therapies, particularly for musculoskeletal conditions. So my research for the past 20 years has focused particularly on looking at what causes intervertebral disc degeneration. So those are the discs in your spine which degenerate and cause low back pain in many cases. So I've been looking at the cellular changes which occur during disc degeneration and now trying to use that knowledge to develop new strategies to treat disc degeneration. So particularly looking at tissue engineering and stem cell therapies. And the reason for this is one of the key issues with low back pain is that actually there's no real good treatments for those patients who suffer from disc degeneration. So there's no therapies at all out there, and people are just left with basically just having to suffer through the pain. So we really need new strategies. So that's what really drives me to try and develop new strategies to help these patients. So Insilico medicine is a really useful way of actually being able to integrate lots of complex areas and ideas together, which you can't possibly do within a wet lab environment. So my principal area is working within wet labs, but actually that knowledge, if we can combine all the knowledge from the different disciplines and different areas that we can get and actually use computer modeling to actually bring all of those complex ideas together, so you can actually understand really complex biological processes and also predict potential therapies and how they may work in individual patients. I think that's the real benefit of Insilico medicine. I think modeling in, understanding the disease processes can tell us a lot more about potential targets, so we can develop more clever strategies for targeting individual therapies to individual patients, but also we can use those computer models to be able to tailor them, if you like, to kind of patient phenotypes and different strategies, so we can actually really get sort of personalized medicine developed where you can put in, for example, particular criteria that apply to a particular patient, and then the model can then tell you which of the therapies are predicted to be able to be useful to them in the most successful manner. I think one of the key challenges to industry in developing sort of new therapies, so particularly for disc degeneration and musculoskeletal conditions, is actually the models that they can utilize. So, for example, in intervertebral disc degeneration, there aren't actually very good animal models which can be utilized to test those therapies. So we need better models to be able to help those industries actually develop new therapies going forward. But also it's the cost of the development. So when you actually have really clever idea and you invent something new, the timeline to actually take that invention from the bench idea all the way to actually getting payback for the industries from the clinic is a very long period of time. So in kind of regenerative medicine, device development, things like that, it can take kind of 20 years from initial discovery to actually starting to get that monetary income back in, which obviously for industry is a big problem. So we need to speed up that developmental pipeline.